Well, if you've had your annual exam and your doctor has said you might have uterine fibroids, you may have a lot of questions like, what are they? Are they dangerous? And should they be removed? Dr. Chang, an interventional radiologist with Baptist Health, joins us with some of those answers to those questions. Dr. Chang, thank you so much for joining me today.
Thank you for having me.
Let's just dive into what exactly are uterine fibroids.
So fibroids are benign, non-cancerous tumors that arise from the uterus. They can vary in size, number, and location. So some fibroids may be very small, but others may grow quite large, up to the size of a grapefruit or larger. Some women may have a single dominant fibroid, while others may have numerous fibroids. And then depending on the size and location of the fibroids, they may cause different symptoms.
Are they common at all?
They're very common. They're actually the most common benign tumor in women of reproductive age, with up to 66% of women having at least one fibroid by 50 years of age.
66%?
Yes,
wow.
Very common.
What are those symptoms then?
So some women may actually never know that they have fibroids, because oftentimes fibroids don't cause symptoms. They may just be incidentally discovered on a physical exam or imaging that was performed for some other reason. If you are having symptoms related to your fibroids, though, they tend to present as either bleeding symptoms or bulk-related symptoms. So for bleeding symptoms, we mean heavy menstrual bleeding or periods that are lasting longer or more frequent than what's typically been normal. Some women may have such heavy or prolonged bleeding that they become anemic, requiring either iron supplementation or, in severe cases, blood transfusion. The bulk-related symptoms are caused when those fibroids grow large enough that they start pressing on adjacent structures in the pelvis. So these symptoms would include pelvic pain, pelvic pressure, abdominal distension, urinary urgency or frequency, and constipation.
What are some treatment options?
So only fibroids that are causing symptoms require treatment. So if you've been diagnosed with fibroids but you're not having any symptoms, they don't require treatment. They're benign, they're non-cancerous, they're not dangerous. If you are having symptoms related to your fibroids, there are a lot of treatment options available to you, so you don't have to suffer. Women who are nearing menopause may choose to undergo a course of watchful waiting, which essentially means wait out your symptoms until you go through menopause, because once you go through menopause, those symptoms really should regress on their own. If you're not nearing menopause, some of the treatment options available to you are going to include a medical management with medications aimed at reducing those abnormal bleeding symptoms. Myomectomy, which is surgical removal of one or more of the fibroids. Hysterectomy, which is surgical removal of the uterus, and uterine fibroid embolization, which is the procedure that I perform.
So let's dive deeper into embolization. How does that work?
So uterine fibroid embolization is a minimally invasive uterine-sparing procedure that's performed in the interventional radiology department, and it's been around since 1995. So the procedure takes about an hour and a half, and you get to go home the same day as the procedure. The procedure is performed entirely through a small catheter that's inserted in a blood vessel in the groin. That catheter is then maneuvered into the blood vessels that supply the fibroids, and through this catheter, tiny particles about the size of grains of sand are then administered into those blood vessels supplying the fibroids. These particles are going to act to stop the blood flow to the fibroids, which in turn is going to cause those fibroids to shrink. And it's shrinkage of the fibroids that's going to lead to alleviation of the symptoms that they cause.
What does the recovery look like after this procedure?
Most women actually can either go back to work or their normal daily activities 7 to 10 days following the procedure, which really gives uterine fibroid embolization the advantage of a quicker recovery time when compared with those surgical treatment options.
What kind of feedback do you hear from your patients who have had this done?
So I've had some patients tell me actually that it's been life-changing for them. Most women will say their symptoms have significantly improved, such that their quality of life has improved, and they can go back to living the life that they were living before they developed all of these fibroid symptoms.
How can women find more information about embolization?
So there's a good website out there called askforufe.com. It's ASK4UFE.com. There's a lot of good information just about fibroids in general and uterine fibroid embolization. So if you're interested in learning more, I would encourage you to visit that website.
How would one know if they're a suitable candidate for this?
So if you have fibroids and they're causing symptoms, then one of the treatment options your provider should give you is uterine fibroid embolization. And if you're interested in going that route, then they can give you a referral to interventional radiology. If they haven't given you this option, then you should ask about it and ask for a referral. Or you can visit that website, askforufe.com. There's a link on there that will take you to a page that's going to give you a list of interventional radiologists in your area. Many of those interventional radiologists will actually accept self-referrals for fibroids, so you can call and make an appointment for yourself to sit down with them talk about your fibroid symptoms, talk about uterine fibroid embolization, and see if maybe this is a good treatment option for you.
Perfect. Thank you so much for coming in. It sounds like this is a lot more common than most women understand. So thank you so much for your time. I appreciate that.